delicate nature of cancer, it came to a point where I got to understand that most often when they go and experiment with cancer and they now go to the hospitals, it makes it difficult for the doctors to administer the help needed. All because by the time they are getting there, I learned on this whole journey that oftentimes their kidney and liver would have been weak to be able to absorb the harsh medication that will be administered by the doctors. And of course, you know, in a traditional setting, no doctor would like to touch any patient that at the end of the day it will bring problem to that doctor. So they will meticulously do whatever needful it needs to be done to ensure that this person is safe, first and foremost, before we try and do whatever that is necessary. So very soon when you see us knocking at your door, we only hope and pray that you open your doors with open arms and receive us.
Every big tree started as a small tree. Every big man started as a small boy. Every big woman, like Mama Zimba, started as a small girl. And scripture says that despise not the day of small beginnings. Mr. Chairman, distinguished patrons and guests, management and staff of the Cancer Project Foundation, Ghana, members of the press, ladies and gentlemen, all protocols observed. It is a great privilege for me to be here this afternoon to give the keynote address as we launch the Cancer Project Foundation, Ghana. Mr. Chairman, as we may all be aware, cancer is reported to be the second leading cause of death globally, claiming some 10 million lives yearly. According to data from World Health Organization's International Agency for Research on Cancer, in 2020 alone, there were over 15,800 recorded deaths in Ghana owing to cancer. Breast cancer accounted for 18.7% of new cases. Cervical cancer, 11.6%. Liver cancer, 14.4%. Prostate cancer, 8.9%. Non-Hodgkin lymphoma, 5%. And other cancers made up a whopping 41.5% of new cases. It is reported that about 70% of the global deaths are from low to middle income countries, including our beloved country, Ghana. Interestingly, more than 40% of all cancer-related deaths are preventable if holistic action is taken on modifiable risk factors like smoking, alcohol use, poor diet, and physical activity. Additionally, about 33.3% of all cancer-related deaths could be prevented through routine screening and tests, early detection and treatment. Not only does cancer lead to death in our country, but also the accompanying stigmatization and difficulties in early detection and treatment all add to the challenges of the disease. I could go on and on with the statistics, but the point is that cancer is increasingly ravaging precious human beings and entire families, even though it is preventable in some cases. This is where the Cancer Project Foundation Ghana comes in. Like a senior doctor friend of mine from Ridge Hospital said, and I quote, "In this part of the country, a cancer diagnosis spells automatic death. So the Cancer Project is handing back breath to cancer patients." Unquote. The foundation aims to intensify research into more effective ways of ensuring cancer patients get the best provisions and management to full recovery. The foundation was established to 1. Support cancer sufferers through treatment, counseling, and rehabilitation. 2. Promote cancer prevention through education and awareness creation strategy, screening and testing, early detection, and treatment to ensure survivability. 3. Provide advocacy in healthcare policies to ensure quality healthcare for cancer sufferers. 4. To support the provision of basic and critical healthcare equipment for cancer treatment. I therefore call on corporate Ghana, religious organizations, foreign missions, charity organizations, and individuals to join us as we embark on this all-important project for God and country. The time to act is now. Thank you for your attention.
Go out, tell a friend, and let that friend also tell somebody that there's a Cancer Project Foundation that is born today, and we are here to stay till thy kingdom come. So let's all come together and make it work. With us.
Cancer Project Foundation, Ghana, has come to stay. We are going to go throughout the length and breadth of the country, seeking information, seeking those who have the cancer. We are going to be there for them like Jesus was compassionately with everybody when he was on earth.